Hi everyone, this is the second session on literature search in public health. I am Associate Professor Dr. Victor Hoe from the Center for Occupational and Environmental Health, University of Malaya. The session consists of literature in public health, planning and conducting a search, and managing the search result. This session we discuss on planning and conducting a search. Last session we look at domains that influence evidence decision making. They consist of best available research evidence, resources including from practitioner expertise, and population. And then that is the information we take to make a decision. We also look at evidence or level of evidence in public health. It consists of system, which is computerized decision making, summaries. Summaries are summaries of research studies, systematic reviews, clinical guidelines, and other evidence. Synopsis of synthesis, basically evidence from journal abstract or systematic review. Synthesis are systematic review. Synopsis of single study, synopsis original article, and studies, original journal articles. Top three are top level evidence. The both are some of the information for basic knowledge about public health issues and could also be used for making decisions on public health in real time. But what if we cannot find the top level evidence? So we need to have a more in-depth understanding of a topic or issue. We need a method to basically systematically search for information, like information from synthesis, synopsis of single studies, or studies. So for this criteria, for literature review, before starting a research, for identifying a research topic, for understanding an issue, and for deciding which investigation equipment to purchase, we need basically to understand or learn how to search for evidence. Planning and conducting the search. We start with step 1. Determining the public health problem. Step 2, defining the question. Step 3, identify the key concept and terms. Step 4, identify the database to search. Step 5, conduct the search. Step 6, retrieve the publication. And step 7, synthesis of the information. Searching in public health differ from other types of search in medicine. This is due to subject breadth, technical demand on the database, the fluidity and the lack of standardization of vocabulary, and the relative scarcity of high-quality investigation at the appropriate level of geographical location. Public health practitioners need a broad exposure to database, grey literature, and terminology in public health. Example, you are a public health executive for a municipal council. The children in a secondary school in your municipal are mostly obese. You want to address the issue. So what do? You search for relevant articles. So the key information is children in secondary school who is obese. You need to search for evidence about health promotion program that works to prevent obesity among secondary school students to prepare your plan of action. So what is the public health question? Health promotion program for prevention of obesity among high school students. To identify the concept and terms, we use PICO. PICO is acronym for Patient, Intervention, Control, and Outcome. But in public health, our patient can be population or problem, intervention or item of interest, comparison, if any, and outcome. For your example, we're looking at problem, obese children in secondary school. Intervention, school-based health promotion program for obesity. Control or comparison continues as status quo. Outcome, reduced prevalence of obesity. This is the PICO question. First, we have to identify the database that we want to search. These are some of the traditional medical databases. It consists of Medline, Pre-Medline, M-Base, Scopus, Science Citation Index, CINAHL, MMed, Spot Discuss, Pedro, EBM, Cochrane database of systematic review. What database you want to search depends on your search topic or your interest. Let's say you want to search for something to do with physiotherapy, then you must search the Pedro. Or you want to search for something to do with evidence-based medicine, then you search for EBM. Other more general search engines or databases that also index journals are your Google Scholar. Now we proceed to conducting the search. We will search the Medline database. There are two main search engines that searches the Medline database. The first is your PubMed, which is free. It searches Medline, pre-Medline, and other National Library of Medicine, citation and literatures. Please keep in mind, Medline are American-centered database. The second search engine is Ovid Medline. This is a subscription-based, and it searches Medline, pre-Medline, EBM, Review, Cochrane database, CINAHL, and Embase. The difference between Ovid and PubMed are the way they search the information. Ovid have more tools to use, PubMed have minimum tools. But to conduct a normal search, PubMed is adequate. Let's start by looking at patient or population, obese children in secondary school. Such term is secondary school or high school or middle school. And we can look at not primary school or preschool. So we combine it with all, and then we combine it with not, but with primary school or preschool. Then intervention, school-based health promotion program. Such term is health promotion and school-based. And we can look at obesity or overweight or weight gain or weight loss. This is the thing that we use. So when we look at all and look at N. So to conduct the search, we start by using PubMed. This is where you can go on and search PubMed. Enter the following in PubMed Builder: secondary school or high school, middle school or primary school. And then you will get something like this in your PubMed Advanced. And when you search, when you click on the search, you'll find the information like this. Thank you for your attention.